Hi guys, Dr. Kid here. In this video, I'm going to go through a review of the medication Dapoxetine or Priligy and tell you how it can be used in the treatment of premature ejaculation. So I'm going to start by defining premature ejaculation, which can have slight variation in the definition, but usually 3 criteria need to be fulfilled. The first criteria is a short intravaginal ejaculatory latency time, or IELT. And usually this is defined as less than 1 minute if you've had this problem lifelong, or less than 3 minutes if this is acquired later in life. The second criteria is that you are unable to delay ejaculation on all or nearly all occasions. The third criteria is that there is a negative personal consequence as a result of this short IELT time. This is a really important one because if you have a short IELT but you have no personal distress or there's no issues with your partner, then there is no actual problem that needs to be treated. So how does Dapoxetine, commonly sold under the brand name Priligy, help with premature ejaculation? Well, Dapoxetine belongs to a class of medications known as the SSRIs, or selective serotonin reuptake inhibitors, and these medications are usually used in the treatment of depression. What is commonly seen with these medications when used to treat depression is that patients often report a prolonged time to ejaculation. Dapoxetine has the same effect, and because it's a much shorter acting medication, it's more useful in premature ejaculation because it doesn't last the whole day. It's only when you need it for sexual activity. So how do you take it? Well, Dapoxetine comes in 30 milligram tablets, and it's usually taken 1 to 3 hours before sexual activity. It can be taken with or without food, and it's recommended that you do not take more than 1 tablet in a 24-hour period. The recommended age of use is between the ages of 18 and 64 years old. So how effective is it actually in treating premature ejaculation? Well, 4 randomized controlled trials were used to evaluate the effectiveness of Dapoxetine on premature ejaculation, and here are the results. So as you can see from this table, the 4 studies showed a baseline intravaginal ejaculation latency time, or IELT. They also showed a placebo IELT. This is patients that took what they thought was Dapoxetine, but actually wasn't. And also the Dapoxetine IELT time after they had taken Dapoxetine. You can see for all the patients at baseline, the average IELT was roughly around 1 minute or just a bit under. And then after taking Dapoxetine, their time of IELT increased from 2.7 all the way up to 3.85 minutes. If you look at the pooled results, the baseline IELT before Dapoxetine was 0.94 minutes, and then after Dapoxetine was 3.1 minutes. Interestingly, patients that were taking placebo also increased their IELT time. So hopefully that gives you an idea of how effective Dapoxetine can be in the management of premature ejaculation. Now obviously these are averages and everyone can respond differently, but they give you a good idea of what you might expect when taking this medication. By the way guys, if you're finding this helpful, make sure that you like and subscribe. That would really help me out a lot. So what are the side effects of Dapoxetine? Well, the most common side effects reported in clinical trials were nausea, dizziness, diarrhea, and headache. So who should not take Dapoxetine? Well, what are the contraindications of Dapoxetine? Well, these include patients that have heart failure, patients that are concurrently taking a class of medications known as the monoamine oxidase inhibitors, patients taking other medications that can increase serotonin. This is because if you have too many medications that increase serotonin in your body, you can get a syndrome called serotonin syndrome. This syndrome can be life-threatening, and you can get symptoms such as muscle rigidity, high temperature, confusion, sweats, and seizures. Examples of medications that can increase serotonin include SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin noradrenaline reuptake inhibitors, tricyclic antidepressants, tramadol, triptan medications, which are commonly used for migraines, lithium, and St. John's wort. Another contraindication to Dapoxetine are patients that are taking potent CYP3A4 inhibitors. This is an enzyme in your liver that helps to break down Dapoxetine. If you're taking another medication that inhibits this enzyme, you're not going to be able to break down Dapoxetine as effectively. This will increase the dose of Dapoxetine and increase the level of side effects. 2 examples of these medications are ketoconazole and itraconazole, which are typically used for fungal infections. The last contraindication is any patient that has severe hepatic or liver disease. So that's my review of Dapoxetine or Priligy. If you found it helpful, don't forget to like and subscribe. If you're interested in other medications that can help with erectile problems, I'll link this video here on Cialis, which is a medication that can be helpful for erectile dysfunction, and I'll see you in the next video.